Hi guys, thanks for tuning in. I'm Dr. K and you're Body Successful. Today we are talking cellulite. Well, cellulite is a modern man's disease, and basically the adipose tissue or fat cells will start extending through the dermal layer and causing this aesthetically displeasing dimpling effect. And it affects approximately 80 to 90% of the people in the Western world, and it affects primarily women. Let's see why. Well, in the female body, the uppermost layer of the subcutaneous tissue, or the hypodermis, consists of freestanding fat cell chambers, and they're separated by these vertical walls or connective tissue called septa. The top of these fat chambers gives under pressure such as weight gain, poor muscle tone, fluid retention, and as the connective tissue slowly deteriorates or gradually deteriorates, the effects will be more pronounced. In male, the hypodermis has smaller fat chambers, and they're surrounded by obliquely oriented septa instead of the vertical ones like the female counterpart. And this orientation allows for a stronger containment and of these enlarged fat cells. So, just from an anatomical or mechanical standpoint, females are certainly more susceptible in developing cellulite, as we see in the picture above. So we understand that the slowly decline in the connective tissue, as well as the decline in the microcirculation with the mechanical pressure, causes this dimpling effect. Now, latest research indicates that the decline in the connective tissue is primarily due to the estrogen dominance. Estrogen is a really important hormone in our body. We need it for so many processes, such as breaking down connective tissue in your cervix when you are delivering a baby to allow for a smoother, more relaxed passage. But the problem occurs when estrogen is not balanced out by other hormones. In other words, you have an abundance of estrogen and a lack of other hormones. This is when the problem of excessive connective tissue breakdown occurs. And this is what cellulite formation as a result of excess estrogen looks like. First of all, estrogen stimulates fibroblasts to make collagenase, and collagenase breaks down collagen around the fat cells, and this starts the dimpling effect. As collagen dissipates, microcirculation is damaged, and the fat cells escape out of the tightly pocketed groups and move towards the skin surface and enlarge to full size, moving to areas of basically least resistance towards the surface of the skin. And as fat cells reach full size, as we see in weight gain, they stimulate creation of more estrogen receptors and exaggerating the basically estrogenic effect. And also, of course, the more fat cells you have, the ovaries are going to be further stimulated to produce more and more estrogen. But how come some women have more cellulite than others? Well, of course, some women are going to be more successful at balancing out their hormones compared to other women. We have toxic accumulation due to everything we ingest through food, water, skin, and so on. So the deterioration of connective tissue creates poor circulation, decreases mechanical resistance, and then the fat cells start to migrate. And these empty pockets provide now space to retain water. And of course, with weight gain, the larger the fat cells become, the more pronounced the potential for the bulging. So see, the thing is, the management of cellulite is a lot more than just some DIYs. And there are several procedures. There are many different things that you can do to manage cellulite. But in order to truly have prolonged results and get rid of cellulite, first and foremost, you have to manage your hormones, and you have to balance out your hormones. And if, however, you're looking into a situation where you want to look into some invasive procedures such that have sound science behind them, there are several that are pretty decent, for as long as you understand that the results are temporary. They are not getting rid of your cellulite. They're going to diminish the look of your cellulite. You're going to have to keep redoing this. It's quite costly, and it is invasive. So the number one procedure that I found is acoustic wave therapy, which seems to be pretty effective for as long as you continuously do it on a regular basis. And contrary to laser treatment therapy, where the results can last up to 1 year, however, it is more invasive. So it is a minimally invasive procedure, though, where they insert the laser fiber inside the skin, beneath the skin, and this procedure is called cellulase. And the laser breaks up the tough bonds beneath the skin and allows also for thickening of the skin. So the results here last approximately 1 year. Another procedure called subcision, or another word you're going to find is sulfina for it, usually has to be done by an MD, a dermatologist, who inserts a needle under the skin and will do a similar procedure as described in laser treatment. And actually here, they reported a pretty large-scale study of 232 people who have reported 99% satisfaction after using this procedure. However, the procedure results only last up to 2 years. Now, last procedure that I found to be pretty decent in terms of sound studies is the vacuum-assisted precise tissue release. And in this procedure, they use a device that has tiny little blades in it to cut all bonds, allowing the tissue to move upwards and fill out and eliminate this dimpling effect. Here again, results can last up to 2 years. Now, again, we have other procedures as well that are less invasive out there, which you have to understand that they are limiting as well. So the effects are limiting, and you also have to use them quite frequently on a daily basis in order to maintain seeing some results. First and foremost, of course, the most important one that is backed up by science is exercise. Exercise is very important and effective in diminishing the signs of cellulite, because it does several things. First of all, it's going to cause improvement in your muscle tone, which gives you a tighter look. It's going to give you a more mechanical hold. It's going to decrease the fat cell size, and as a result, it's going to decrease the dimpling effect. It's going to increase circulation. Now, this is super important. Remember, part of the problem with cellulite is the decrease in microcirculation. When you increase circulation, you're going to you're going to flush out the metabolic effects of contraction. Plus, you're going to flush out a lot of toxins, and as well, that are lodged in the fat cells that are causing this estrogenic effect. And also, you're going to accelerate the repair process of the connective tissue due to the increase in the blood flow. So, also contrary to what I wanted to also mention is sometimes I see these exercises that are specifically for cellulite. They like do these 4 exercises, 5 minutes a day, and then you're going to decrease cellulite. There's no such thing, you guys. Decreasing cellulite, it has nothing to do with a magic formula of exercises. Basically, you have to, all they do is they target the areas where you're going to see more likely to see cellulite, such as your thighs and your butt. So these are not magic formula exercises. These are just basically resistance training exercises that are going to focus on different areas where we're more likely to see that cellulite. So have a good sound strength training routine, complement it with some cardio 2-3 times a week, and you're good to go. Now, also contrary to what most people believe, that massage, we thought in the 90s that was a great thing to do for cellulite, and today we know that that is not the case, because it can damage the very connective tissue that you're trying to actually build up. So deep tissue massage is not a proper thing to do when you're trying to diminish the signs of cellulite. Now, there are a lot of topical creams and DIYs that are out there. There are some more effective than not. But then again, their effectiveness will depend on how frequently you're using it. And of course, you have to understand that they are limiting. I saw this formula that I thought was pretty standard throughout, and people gave positive results from using it. And it is basically equal parts coffee, brown sugar, organic coconut oil, and cinnamon. And you would mix this into a nice scrub, and you can store it in an airtight container in your shower, and you can use it on a daily basis when you're showering. You would apply it in a circular manner and massage it into the area that you'd like to improve, and you would wrap it for 10 to 15 minutes with cellophane, after which you would wash it completely off. And this is a pretty good DIY to use on a daily basis to see some improvement or temporary improvement in your skin, especially if, let's say, you have an event that you'd like to go through, then you want to work up to that event with this formula, which is not too bad. So the thing is, the bottom line is there are a lot of things that you can do, and some are really expensive, some are really inexpensive, some are more effective than others. But the bottom line is, in order to get to the root of the problem, or in order to truly eliminate the signs of cellulite and stop the cellulite from further forming, you have to balance out your hormones. You have to balance out the estrogen in your body. Furthermore, after that, you have to eat well. You have to eat foods that are free of harmful chemicals. You have to live organically, and you do have to exercise. If you continue doing all these things on the long term, then you will be successful at ridding your body of cellulite completely. So how is it that in our Western world we are so estrogen dominant? Well, basically, estrogen dominance is due to our way of life. We ingest so many toxins through the air, the water, the food, our skin, that are really harmful, have an estrogenic effect in our body, and cause complete endocrine imbalance. And a group of these chemicals or compounds that are ubiquitous basically to our society are xenoestrogens. And this is a big topic that I could spend a whole video on, so you can go ahead and research them for what typically they are. But the bottom line is, these compounds that are man-made have estrogenic effects. They mimic the effects of estrogen. As a result, they cause a complete endocrine dysfunction and estrogen dominance in our body. And as you can see here, these estrogens disrupt because they lodge into the fat cells and are pretty resistant to breakdown. So many of these xenoestrogens will act as synergistically together, exponentially promoting estrogenic function, causing basically devastating hormonal dysfunction. So in order to, if you find yourself in this situation, the number one thing you have to do is consciously try to normalize your estrogen levels before you even think about tackling anything else that would be effective for reducing cellulite. So these are some of the things that you can do. Number one, of course, you have to try to stay away from xenoestrogen and endocrine disruptive stuff such as plastics, parabens, sodium lauryl sulfide, oral contraceptives. I mean, and the list goes on. This is a huge topic that you can research on your own, or if you guys are interested, I can do a whole video on. But the bottom line is you have to really get rid of rid of all these substances in your life in order to, which is extremely difficult to do, in order to start detoxifying the body of these xenoestrogens. You have to drink enough water. Drinking about half your body size an ounce of water in ounces is really important. Adding some lemon or apple cider vinegar for added detoxification is really good. You should practice intermittent fasting because this is going to kickstart and amplify all your detoxification pathways. Fasting 16 hours a few times a week is very doable, and it will have wonderful effects. Now, also consuming indole methane. Diindole methane is a natural extract that they extract from sprouts and from broccoli, and it is really good for you because it's going to stop the or it helps the body neutralize these reactive estrogen metabolites, and it's going to encourage the production of the non-reactive estrogen. And 300 to 600 milligrams is probably an appropriate amount to take on a daily basis. Now, of course, again, regular exercise, you said it's important for so many other things, and also from putting all these toxins, mobilizing all these toxins into the circulation so you can get rid of it, because metabolizing these fat cells means that you're releasing the toxins so you can get rid of them. So that's also really important. And as we said, high resistance intensity training is an appropriate way to exercise. Juicing greens or just having green powders on a regular basis is really important because it's going to give you adequate chlorophyll and phytonutrients. There are going to be very helpful in the detoxification process. Improving your gut metabolism, your gut mobilization is really vital as well. And you can be doing anti-inflammatory diets, which are going to be high in fibers from like flaxseed and chia seeds. Taking probiotics, apple cider vinegar, bone broth, fermented foods. These are some of the things that you can do in order to help you with that. Now, reducing excess estrogen we can do this in two ways. We can decrease the production, and we can stop the receptor size. Decreasing production is by taking certain substances that are going to stop the action of aromatase, which basically is an enzyme that is primarily responsible for stimulating the production of estrogen. And you can do that by taking things like chrisin, flaxseed, green tea, and what was another thing? Oh, and zinc is another important thing that you could be utilizing for that. Now, in order to stop the effects or block the receptor sites in estrogen, you could be utilizing things like gliadins from flaxseed and isoflavones of soy. And these are not estrogens, but they have the molecular structure that's very similar to estrogen, so they can block receptor sites and as a result block the effect of circulating estrogen. So there you have it. This there's a lot of things and a lot of tools that you can have, some more invasive than others, some more costly than others. The bottom line is if you want to truly manage and stop the formation of cellulite, there's certain things you have to do. You certainly have to normalize your estrogen levels to stop further proliferation and formation of cellulite. You have to exercise to minimize the amount of cellulite you have, because you're going to decrease the fat cell size as well as increase muscle tone for tighter look. And you have to have a good detoxification program in progress on a daily basis that you have to do in order to make sure that you're going to have lasting results. That's it from me, guys. If you liked the video, please give me a thumbs up. And if you're new to this channel, please don't forget to subscribe. So and also grab that little bell so you're not going to miss out when I'm posting new information and new videos on the channel. This is Dr. K, all the way.